High-protein diets, are they bad for osteoporosis kidneys? Have you ever wondered if a high-protein diet could be harmful to your kidneys, especially if you have osteoporosis? This is a common question, and it's important to understand the facts. High-protein diets are generally not bad for kidneys in people with osteoporosis who have normal kidney function. In fact, adequate protein intake is crucial for bone health. Research shows that protein plays a beneficial role in maintaining bone mineral density and reducing fracture risk in older adults with osteoporosis. Studies indicate that consuming protein above the recommended dietary allowance of 0.8 grams per kilogram of body weight per day is linked to higher bone mineral density, slower bone loss, and a reduced risk of hip fractures. This is particularly true when calcium intake is sufficient, which is vital for managing osteoporosis. Now let's talk about the kidneys. The concern around high-protein diets often comes from the acid-ASH hypothesis. This theory suggests that a high-protein intake can increase acid load in the body. The body may then releases calcium from bones to buffer this acid, which could lead to increased calcium excretion in urine. This was thought to stress the kidneys and harm bone health. However, more recent evidence challenges this idea. Higher protein intake can actually increase intestinal calcium absorption, which may help offset urinary losses. For individuals with normal kidney function, high protein intake, even above 1.2 grams per kilogram per day, does not seem to damage the kidneys or worsen osteoporosis. Some studies have shown that very high protein intake might increase markers of bone turnover, but the clinical significance of this is still unclear. It may depend on individual factors like activity level and calcium intake. However, for those with chronic kidney disease or impaired kidney function, high-protein diets can be harmful. In these cases, the kidneys have a reduced capacity to handle the waste from protein metabolism. Therefore, protein intake is often moderated to reduce strain on the kidneys, which should be guided by healthcare professionals. In summary, for osteoporosis patients without kidney disease, adequate to moderately high protein intake supports bone health by maintaining bone mineral density and reducing fracture risk. It is essential to consume protein alongside sufficient calcium and other nutrients that support bone health. High protein intake does not generally harm kidneys in healthy individuals. However, excessive protein intake beyond certain thresholds may have complex effects and should be balanced with a diet rich in fruits and vegetables to help reduce acid load. For those with kidney impairment, it is crucial to manage protein intake carefully with the help of healthcare professionals. So, high-protein diets are not inherently bad for kidneys in osteoporosis patients, but they must be balanced and tailored to individual health status, especially kidney function.